Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Kasim. This is the Muslim Insight, sitting in for Zamzam Ahmed. It is 24th January 2025 and my sign language interpreter today is Abdul Wahab Ali. We focus on breast cancer. What is a breast cancer? What are the effects of breast cancer? What are the causes of breast cancer? How is breast cancer diagnosed? Today, I'm joined by Dr. Iram Shabir, a health specialist and a breast ankle plastic surgeon. Daktari, assalamu alaikum wa rahmatullahi wa barakatuh and welcome.
Thank you so much, Qasim. Wa alaikum salam wa rahmatullahi wa barakatuh.
Maybe our viewers at home are asking themselves, who is Dr. Shabir?
So my full names are Dr. Iram Shabir, and sorry, my title is a bit difficult to read,
Okay.
but basically I'm a breast specialist.
Okay.
So we, in the medical field, they call us a breast oncoplastic surgeon. Okay. So I specialize in all sorts of breast conditions, but I do the surgical aspect of the breast diseases. So when any form of surgery is required for breast cancer or for even non-cancerous lesions in the breast, then I'm the sort of doctor that you would be looking for.
MashaAllah. Maybe before someone does surgery, before someone becomes abnormal, I understand that breast cancer is abnormality in breast cells, right? So maybe before we get into breast cancer, what is the structure of a normal and healthy breast?
Yes. So, well, if we look at the breast, it lies in our chest cavity, as we all know it.
Yes.
And males have breasts as well as females. And if you look at the cross-section or the inside of the breast, it has what we call the glandular component and the stromal component. So basically the breast is a gland, and its purpose is to produce milk for lactation. And it has two components. The glandular component is the one that produces the milk. And the glandular component has two main components inside it. Those are the lobules and the ducts.
Okay.
So the lobules is where the milk, they're packets kind of thing, where the milk is made, and then that milk gets carried to the nipple through what we call pipes or the ducts. So in a normal breast, we have around 15 to 20 lobules, and likewise we have around 15 to 20 ducts that carry that milk to the nipple. So that's the glandular component. Then we have the support structures that support the glands and the tubules, and that we call the stromal component. And the stromal component is made up of mostly collagen fibers and some fatty tissue. So basically, in a nutshell, that's what the breast is all about.
Yes.
It's that simple.
Now, our viewers back at home are worried about breast cancer. Many people take it as a killer disease.
Yes.
And it is a killer disease indeed.
Yes.
So maybe define for us what breast cancer means.
Yes. So, well, generally women do fear breast cancer, and they have a very good reason why they fear the breast cancer, because in the past the mortality or the deaths related to breast cancers were very high. So people have that mindset that if you have cancer of any form, including breast cancer, then it's a death sentence for you. But now in today's world, a lot has changed. We have a lot of different modes of treatments that have come up. And good news for us is that most of the cancers now, including breast cancer, is being identified way earlier. And we are able to treat almost 60 to 70% of the breast cancers that we see in our clinics.
So what is a breast cancer?
So breast cancer is basically, so the problem with cancer starts in the cells.
Okay.
Not just breast, but any form of cancer. It starts with the cell cycle. So normally our cells divide as we grow. And if that division gets affected because of any reason, because of any form of mutation that can occur in our genomic component, that is the DNA or the RNA, then we can have the cells, instead of multiplying at a regular basis, they become metaplastic, which means that they divide very, very fast, more faster than the normal rate of cell division. And so because they're dividing so fast, what is getting produced from those cells are abnormal cells, which can't do any good. They only cause harm. And that is why most cancers present with growths, because of the cells growing so fast in our body.
Oh, yes. Thank you so much for that clear explanation. I was reading a certain article from the World Health Organization, and it says about 2.3 million people worldwide were diagnosed with breast cancer. About 670 people worldwide by 2022 died because of breast cancer. It is one of the most disease that is feared by men, by women, being as a death sentence. But now my question is, how can someone at home know what breast cancer is? Tell us the signs and symptoms of breast cancer.
Yes, thank you. That's a very good question, and I think it's important to know. Of course, most breast cancers present with a lump in the breast, but also I would like our audience to appreciate that not every lump in the breast is breast cancer. So if a lady feels a lump in her breast, she must not get anxiety. She must approach a reasonable hospital and get it checked up, because it might be cancerous or it might be benign as well. And by benign I mean maybe it's not a cancerous lesion. But apart from that, we have to appreciate that apart from the lump, breast cancer can present in other forms as well. So ladies can get some nipple discharge, and most of the time the nipple discharge is bloody, but it does not always have to be bloody. Sometimes it appears with the skin thickening, so the breast skin really becomes thickened, and because of that thickening it appears like an orange what we call purely orange appearance. So it just appears like an reddish ball-like breast that is becoming harder compared to the other breast. So these are some of the other ways. Or it can just present with an ulcer on the breast that is not healing. So these are some of the other ways it can present with.
Okay. From your definition, you say that this occurs when a healthy breast cells becomes abnormal.
Yes.
What are the causes? And maybe we talk about the risk factors of breast cancer.
Yes. So Qasim, when we talk about the risk factors, we can categorize them for easy understanding into those that are modifiable, which means we can change them, or non-modifiable, which means they can't be changed.
Okay.
So when we talk of modifiable risk factors, it's mostly our lifestyle. So you know, like alcohol intake, smoking has been associated with breast cancer, obesity, and obesity is a major factor in most cancers, including breast cancer. Really, increased weight causes is a very big predisposing factor to breast cancer. And also, like not eating a healthy diet, you know, not exercising regularly, and prolonged exposure to hormones like estrogen. So ladies who keep taking a lot of estrogen pills for family planning, or any mode of family planning for prolonged duration, can increase the risk of breast cancer, because some types of breast cancers are fed by estrogen hormones in our body. So when we take these tablets or implants, whichever way you're using it for family planning, they can increase your risk of getting breast cancer. Also, ladies who have had who started their periods early, that is before 12 years, and then stopped their periods, so they got menopause much later, maybe in their late 50s or 60s. So you see, if you get early menses and then you get a late menopause, those ladies get exposed to estrogen for a longer time. So then those ones are also, that's also a risk factor. So those are some of the modifiable risk factors. Then we have the non-modifiable, which we can't do anything about. So like you hear certain kind of families are more predisposed to cancers in generally. So the cancer keeps running in their family. So that's familial breast cancer. Some ladies have genetic mutations in their genes which they can't do anything about. So the commonest genes, for example, are the BRCA1 and the BRCA2 genes. And then we have other genes like P53 and many other kind of genes that predispose these ladies to getting breast cancer. So those are some of the non-modifiable risk factors that predispose the lady to breast cancer.
Mashallah, maybe before I go further, there is this question that is coming into my mind, like, can the change in the breast size and the breast shape define if this is a breast cancer?
Well, yes, of course, if it's a big tumor that the lady has, then the one breast can obviously become bigger than the other breast. So if you feel like your one breast is becoming way bigger, but by then you'll obviously feel some hardness in that breast or a lump in that breast. Yeah, so it can, and skin changes, as I explained earlier, that can happen in breast cancer, yes.
Maybe talk about skin change. What is the color that appears on the skin? Which part of the skin? Is it around the breast? Is it in the face? Where exactly?
Well, of course it's in the breast, but you see, if it's a well, skin color will depend obviously on the natural color of the lady. So people who are more fair, then you can see reddening more of their skin. But if the skin color is darker, then you see more of darkening of that skin, and also you see small like punctate, by punctate I mean like deeper lesions because of edema, or you see what happens when you have breast cancer. There's something we call Cooper's ligaments inside the breast that support the breast. I talked about the support structure for the breast. So one of the stuff that supports our breast tissue are called Cooper's ligaments. So if cancer involves the Cooper's ligaments, then the Cooper's ligaments pull the skin inwards. So you get like small dots on that skin, and then sometimes you see even the nipple that is normally projecting outwards can now project inwards. So the lady notices a change in her nipple also, and that is simply because of the involvement of those Cooper's ligament into the breast tumor that's inside the breast.
Mashallah, your point brings me to another question. Can men get breast cancer, and what are the risk factors for men to be diagnosed by breast cancer?
Okay, I think that's a very interesting question. Of course, men can get breast cancer. The frequency, so around 1 to 2% of men can get breast cancer, simply because men also have breast tissue, although it's not as common as the women getting breast cancer. And what predisposes a man is basically if he has a family history in his family for breast cancer. In the ladies, maybe there's multiple ladies in the family who have been getting breast cancer or who have been getting other forms of cancer like ovarian cancers. Then that man in the family can get predisposed to getting breast cancer. And also maybe a man has genetic mutations, the genes I talked about. Even men can have BRCA1, BRCA2 genetic mutations, so that predisposes them. And men who have had prior history of radiation to their chest wall. So sometimes in hospital we give radiotherapy for certain kind of diseases, especially sarcomas. That's a type of tumor as well. So if a man has had radiotherapy for some reason, especially to the chest wall, then that breast tissue gets predisposed to getting breast cancer in the future.
Okay. Maybe they say prevention is better than cure. Before we cure breast cancer, what are the prevention methods that someone can use before, or instead of him finding himself or herself getting breast cancer?
Yes. So I mean, prevention is basically targeted at the modifiable risk factors that I talked about. So if you're a chronic smoker, then to stop smoking would be a very good idea. Reducing alcohol intake, if you do that. Weight loss really helps, because the ladies who have a high BMI or are obese, then they have a lot of fatty cells in their body, and these fatty cells the excess fat in their body can get converted to estrogen hormone, and that hormone can predispose them to getting certain types of breast cancers. So naturally, if you reduce the levels of fat cells in your body by losing the weight, then you automatically prevent getting cancer. And then, like any other cancer, regular exercise is very important. Eating healthy diet is extremely important. So those are some of the prevention measures that can be taken by these ladies. And most importantly also is to put yourself in a screening program. So, and self-examination. So I think before you even go to put yourself into a screening program somewhere, is to examine yourself. And most of the time these examinations should be done immediately after your periods. So when the lady has finished her periods, because that's the time when the breast is very tender, and if there is a lump in the breast, it can be felt more easily because of the softness of the breast at that time.
On that, screening.
Yes.
How can we do screening? Because there is those people who say you self-examine yourself by rapping at the nipple.
By palpating, yes.
Yes. How is screening done, and how important is screening?
Well, so self-examination is, it's a bit different from screening.
Okay.
Self-examination is what we do at home, and we examine the breast ourselves. And then screening is when you take yourself to a hospital and tell them, look, I'm worried, maybe I have breast cancer. I want to do maybe an ultrasound or a mammogram. So those are imaging related detection tests. When they're done in the hospital, that is screening. So self-examination which you do at home is basically, you can watch, there are a lot of YouTube videos as well, but basically the lady should stand in front of the mirror and place the hand behind her head to give a good stretch to the breast tissue. And then now if you imagine the breast as a circle, you can divide it into 4 parts, and then the lady is supposed to go from one quadrant to another. So just gently palpating each and every quadrant until she comes back to where she started from, and she's trying to feel for any lumps at that time. And then also she's supposed to press around the nipple and see if there's any abnormal discharge that she's getting from the nipple, which was not there before. And also don't forget to examine the axilla. So the axilla is, we have axillary nodes right under the armpit, and those nodes are important to examine, because even the breast tissue is not just round circle, it is a round circle, and it extends, it has a tail that extends into the armpit, and there are nodes there. So when you have tumor in the breast, the first place most tumors spread is to the nodes in the axilla before they go anywhere else. So obviously when they get cancer, they become harder. So it's very important you examine the breast, you examine the nipple, and then you place your hand also in the armpit and examine the armpit as well, and check for any abnormal hardness that was not there before.
Okay, as experts, how do you detect that someone has breast cancer?
Well, we start with the history from the patient and the symptoms that the patient has come from. That gives us a pretty good idea of what we are dealing with. Is it something benign, or is it something suspicious or cancerous? And then we confirm them in the hospital with certain tests that we do. So we take a biopsy of that lesion, and then we do ultrasounds, and we do mammograms, and we can do MRIs of the breast and CT scans, depending on what the patient has come with as her symptoms.
Okay. On that, I want you to define for us what biopsy means, and at what point is biopsy take place. You said when a patient comes to the hospital, he or she is examined. They check the background history of the patient, but now maybe someone who is at home, he doesn't understand this serious jungle called biopsy. What is biopsy, and at what point is biopsy happen?
Okay, so well, a biopsy is basically taking a sample of the tissue from the lump that the patient has, and we use something we call a biopsy gun. So when you come to the hospital, we inject you with a bit of local anesthesia, and then we basically shoot into the tissue into the lump itself, and then we retrieve that biopsy gun, and when as it comes out, it will come out with a piece of that tissue or that lump, and then we collect a few of such tissues and we take them to the lab. And because now that is tissue from the lump, we can look at it under the microscope and see if there is any cancer cells, or is it what kind of cell, or what is the histology showing us.
I want to take a very short break, but when we come, you will tell us the types of biopsy. You will also tell us what someone should understand about different stages and grade. There is grade and stage of breast cancer. So when we come back, you will help us understand that. Ladies and gentlemen, we take a very short break. We will be right back after a few minutes. Assalamu alaikum wa rahmatullahi wa barakatuh. This is the Muslim Insight, our second segment. We're focusing on health, which is your wealth. In studio, I'm joined by Dr. Iram Khan, who is here to tell us about breast cancer. In our first segment, she talked about the causes of breast cancer, symptoms of breast cancer, and the definition of breast cancer. So, Daktari, before we took a very short break, I had requested you to tell us or highlight for us types of biopsy. So what are the types of biopsy?
Well, so the types of biopsies, biopsy is basically just taking a sample of the tissue, and the different types of biopsies are just named differently because of how we get that tissue. So what we normally do for breast lumps is take a core biopsy, and a core biopsy is the one I described earlier on, where you use a biopsy gun and get small tissue samples. But sometimes it becomes difficult to take the core biopsy, or the core biopsy doesn't give very good results because cancer is normally surrounded by a lot of dead tissue as well. So we might take a core biopsy and it just gives us a report of dead tissue. So then we can do something we call a wedge biopsy. And a wedge biopsy is basically we cut into a wedge shape, that is an inverted V shape, dip into the tissue bed so that we're able to overcome the dead tissue around the cancer and still get a sample of the cancer tissue itself, or the lump itself. And then now we can also do an excision biopsy sometimes. So an excision biopsy is when we normally just remove the entire lump, and then we send that for histology, and after removing the entire lump itself. So that's what we call an excision. So we can have a wedge, an incision, or a core biopsy. And sometimes we do take something we call an FNA, that's a fine needle aspiration. That's not really a biopsy, it's something we call a cytology, because that one we are targeting more of the liquid cells that are there. So if like I talked about the nodes in the armpit, if we are suspecting some nodes are enlarged, then we can take a needle and a syringe and go and aspirate some of the liquid from those nodes, and then take that sample to go and see under the lab and see if it's showing us any cancer cells. So that's an FNA.
Okay.
Yeah.
Maybe talk about the stages of breast cancer for someone to understand very well about what breast cancer is and the stages of breast cancer. Kindly talk about it.
Okay. So, well, stages can either be stage 1 to 4, and I think that's how most of our population knows it as. So, stage 1 and 2 are early stage cancers, and luckily for us in today's world, most of the cancers that we see are actually stage 1 and 2 cancers, and those are treatable cancers. Then we have stage 4 cancers. I'll skip the 3. Stage 4 cancers are cancers that have spread into the bloodstream, and once it has spread, then it becomes really difficult to get that cancer or to treat it, because now it can go, and the cancer cells can go and land in any organ and affect any organ. So it becomes difficult to treat multiple organs. And stage 3 is when it is localized to the breast and the chest wall, but it has spread more. So it has spread beyond the breast tissue, but it has gone maybe to the muscles of the chest wall, because the breast normally lies on a muscle. So if the cancer has come out of the breast tissue and it has gone into the muscle, then that would be maybe a stage 3. But medically, we stage them into something we call TNM staging, and TNM staging is basically according to the size of the tumor. So the bigger the tumor, the bigger the T stage. So we have T1, 2, 3, and 4. So T4 is obviously the biggest size of tumors. Then we have the end stage of that, and end stage is the nodal involvement. So the nodes in the armpit, how many of them are involved. So that gives us stage 1, N1, N2, N3, N4, depending on the number of nodes that are involved. And then finally we have the M stage, which is whether the tumor is metastatic. By metastatic I mean, has it spread or has it not spread. So we have the M stage for the tumor.
Okay, so to mean in stage 1 it's either non-invasive or invasive, right?
No. So this staging is mostly for invasive cancers.
Okay.
For cancer, so when we looked at the ducts, because most of the cancer, you remember I talked about the structure of the breast, and I said that we have lobules where the milk is made, and then we have pipes, what we call the ducts, that carry the milk to the nipple. Now most of the cancers starts in those ducts, those pipes. So we call them tubular cancers because those pipes are called tubules. So we call them tubular cancers. Now the cancer can either be within the wall of that tubule or within the wall of that duct. So those are called non-invasive cancers.
Okay.
And like we have ductal carcinoma, DCIS, or we have LCIS, that is lobular carcinoma in situ. Once they penetrate the wall of either the lobules or the tubules, and they have come out of the wall, now that becomes invasive cancer.
Okay. Maybe now that is invasive, it have already spread throughout the body, that becomes metastatic, right?
Yes.
Now talk about metastatic. How riskful or how dangerous is metastatic stage of breast cancer?
Well, it's not one of the best stages to be in, I would say, but because now, as I explained, it has spread into the bloodstream and it can go and affect multiple organs. But all the same, if the number of organs that it has spread to are limited, and the size of the tumor that has gone there is also very small, then we still have options for treatment for such ladies. So metastatic disease really is very complex, and I think its treatment is patient based. So whether it really depends whether it's treatable or not. That is, it will really depend on how much of that tumor has spread into the bloodstream and how many organs is it involving, and the organ that it is involving, how big is that tumor in that organ? Is it 1 centimeter? Is it just a few millimeters? So it really depends on a lot of factors. But as I said, because now breast cancer is treatable when it's caught early, and that is why I guess we're having this conversation today, so that people are aware of what to look out for, and they can get treatment earlier before we get to that metastatic stage.
You said breast cancer is treated. What is the treatment? How is treatment of breast cancer, and what are the modalities maybe of breast cancer?
Yes. So so they're localized treatments, and then they're systemic treatments.
Okay.
So by localized, I mean what can we do to that breast to treat it? So we can obviously do surgery to it to remove the tumor, or to remove the entire breast, depending on how big the tumor is and many other factors. But what we need to appreciate is that we don't always have to remove the breast of the patient. We can just remove the tumor and leave the rest of the breast intact. So that is surgery. Then we can do radiation. Once we have done the surgery, we can do radiation to help control any remaining cancer cells that might be left back after the surgery. So that is radiotherapy. Then we have systemic treatment, and systemic treatment is the chemotherapy drugs that we've always been given. But now, luckily, in addition to the chemotherapy drugs that we have been giving, we also have something we call immunotherapy or targeted therapy drugs, and these have proven in many studies to be very useful as a mode of treatment. So certain type of cancers and in certain stages of the cancer, we are able to use the immunotherapy drugs, which are very effective.
Okay. Maybe talk about the stage. What is breast cancer stage, and what are these stages?
I think we already spoke about the stages.
Maybe the grade.
The grade, okay, yes.
The grade of
yes.
breast cancer.
Yeah, so there is a difference between the stage and the grade.
Yes.
So the stage is what I explained earlier on, because what we use to decide on the treatment of the patient. But breast cancer, as we know it, can be of different grades. So we have grade 1, 2, grade 3 cancers. So that is something we see in the lab, depending on how those cells, once we have taken the specimen by biopsy, for example, or we have excised the tumor. By excision, I mean we have removed the tumor. Then we take the tumor to that sample, we take it to the lab, and then it's viewed under the microscope. Now, depending on how fast or how those cells appear, are they appearing like they were dividing very fast? Are they appearing like there's a lot of dead tissue around them? The pathologist will grade that tumor for us into grade 1, 2, and 3. And grade 1 tumors are obviously the good tumors to have, but the grade 3 tumors are the ones that are more aggressive.
You talked about radiation, surgery, chemotherapy, homotherapy, and so very many other ways of treating breast cancer. At what point is radiation or chemotherapy applied?
Well, so radiation is mostly applied after the surgery, because we are just trying to get rid of the smaller cells or the minor tumor cells that we might have left behind after removing the tumor itself. So that's when radiation is helpful to us. But also sometimes when cancers are very big or they're bleeding a lot and we want to control that, then we do use radiation even for the very big locally advanced cancers. But chemotherapy can either be used before doing the surgery, so we say it's neoadjuvant chemotherapy, or we can use it after we've done the surgery, that is adjuvant chemotherapy. So before the surgery, we use it to help shrink the tumor. So when a lady comes to us with a very big tumor, and we feel like it's good if we can shrink it before, then we give her chemotherapy first to help control the tumor, and then we go and operate on her. That way we remove less of her breast tissue compared to, and also we want to see which chemo drugs is this tumor responding to. See, if we go and remove the cancer up front, then it's hard later on if I want to give her chemotherapy. Now it becomes hard for me to know whether the regimen, the chemo drugs that I want to give her, whether they're going to work on her or not, because now there's no tumor in her body for me to assess the response to the treatment.
I've seen people who've done surgery and they've either lost one of the breast or both. Now talk about the surgery. Now that you've talked about chemotherapy and hormone therapy and radiation, I want you to talk about surgery. At what point can someone, you as specialist, decide that this patient, we have to cut off all the 2 breasts, or we have to remove one of the breasts? At what point is it?
Well, so most of the times our aim is basically to remove only the tumor and not to remove the breast, because breast is an important organ in a woman's body. It's what describes her as a woman. So we try our best not to remove the breast, but sometimes we are forced to remove the breast. So if the patient's tumor is very big when she comes to us, and we do try to give her chemotherapy, for example, but the chemo is not working so well for her, it's not helping shrink the tumor for her, then we would consider removing that tumor with the breast. Sometimes if the tumor is what we call multicentric or multicentric or multifocal, which means she has cancer in the same breast but at different parts of the breast. So it becomes hard then to just go and do breast conserving surgery for her, and we are forced to remove the breast for her. But ladies who are genetically predisposed, so if a lady comes to me in her 30s, for example, and 40s, and she has breast cancer, I will wonder why such a young lady is getting breast cancer. And so I will take a good history, and there are some tools we use to decide whether she has genetic predisposition in her. And if we feel that she might have some mutations in her genes, then we will send her for genetic testing. And if it comes back as positive, which means she has some genetic mutations in her, then it's better to remove both her breast so that she does not in the future get cancer in the contralateral breast. But that is a decision, of course, that has to be made between you and the patient after you've discussed the risk factors for her to get cancer in the opposite breast. It's not always that she might need the surgery. There are other modes of treatment that we can use to help prevent her from getting cancer in the opposite breast. But that is for the lady to decide. We can only give her the options, and then she decides on what she wants. So sometimes, yes, we do discuss with the patient the possibility of removing both breasts. But in today's world, we don't have to leave the patient flat-chested like we used to before. So there are a lot of reconstruction modes that have come about. So while we all know that we can put implants for these ladies, and also not just for the ladies who have breast cancer, sometimes ladies just want to have bigger breasts. So we do something we call an augmentation mammoplasty for such ladies, which means we put implants together with their breast tissue that makes the breast bigger. Sometimes after removing the breast, we put an implant to make her get a breast. And sometimes we do other forms of mastectomy, where we don't, we remove the breast tissue, but we spare her skin, and we use that skin to reconstruct another breast for her in the same surgery. So she is not flat-chested after that. So there are a lot of reconstruction modes that we can now use so that the lady is not just, doesn't just have a flat chest.
Now on that, about surgery, deconstruction, talk about, you said you do mastectomy. Talk about simple mastectomy, modified mastectomy. Let people understand what is mastectomy in the first place. What is a modified mastectomy? What is a simple mastectomy? What is a we call it prophylactic. Yes, prophylactic. What is a prophylactic mastectomy? Maybe let people understand what is it and how it's done, then we move on.
Okay. Wow, this is, Qasim, these are very intense questions, but I'll try to answer them. So we have, mastectomy is basically removing the breast tissue from the lady. So we can have a simple mastectomy where we only remove the breast tissue. And then only the breast. Now if we go into the armpit for the nodes in the armpit, that becomes a modified radical mastectomy. And that we do mostly for cancers. And then we have prophylactic mastectomy is what I told you, like a lady, if she has genetic mutations and she's scared that she might get cancer, because these ladies have a tendency, they're predisposed, the chances of a lady getting breast cancer after when she has a genetic mutation is in the range of 60%. So she has a 60% chance that she'll get cancer even in the other breast. So that way we remove the other breast that does not have cancer, and that's a prophylactic mastectomy. Okay.
Maybe explain for us what a metastatic cancer means, and how is metastatic cancer unlikely to affect the body organs?
Yeah, so I think we touched on metastatic cancer, and I explained that it's basically cancer that has spread to the body. And breast cancer, spreads obviously first to the lungs, because those are organs that are found in the chest cavity. It can spread to the liver, it can spread to the bones, especially the spinal cord, but it can spread to many other organs, but those are the main organs that it spreads to, and that is what we call metastatic disease. And of course, when it goes to those organs, then it damages the normal organs, so the patient can even go into failure. For example, if it has spread a lot to the liver, it can affect the liver such that the functionality of that liver reduces remarkably, and the liver is not able to do what it normally does to its maximum capacity.
Oh, nice. Now talk about how our healthcare system is supporting breast cancer treatment in our country, specifically Kenya.
Okay. Well, so I think most hospitals now in Kenya have appreciated the importance of treatment for breast cancer, and most hospitals, both public and private, do have the facilities for treating breast cancer. They have specialists, they have the radiotherapy machines, well, they have the imaging for diagnosis. I think like maybe Kenyatta National Hospital has most of the equipments that we require. Kenyatta University Hospital is also another one. They have most of the equipments that we require. Then if you talk about the private hospitals, most of the main private hospitals, be it Nairobi Hospital, Aga Khan, Mpisha, so most of these hospitals do have the technology we require to treat breast cancer. And of course, SHA covers for most of the treatment options in the government hospitals.
There is those people who've been treated and they are really doing very well. I saw a testimony of 2 ladies who were diagnosed by stage 3 breast cancer, and they said they are doing very well. My question is, they are surviving, if we may say so. So what is survivorship of, or who is a survivor of breast cancer?
It's a survivor of breast cancer is basically a person who has gone through the journey, was diagnosed with breast cancer, went through maybe the entire spectrum of treatment, and generally it's not an easy journey. We sit here and we talk about chemo and radio and surgery, but for the patient it's hard to even understand what the patient is going through. It's a lot of pain, it's a lot of stress, both psychological stress, it's physical stress, there's a lot of financial toxicity, not only on the patient but the family members, and the extended family goes through a lot for the treatment to be enabled in that patient. And so yes, in today's world we do have a lot of survivors. So breast cancer treatment can take anywhere between 9 months to 1 year or even slightly longer, depending on what the patient has. So it's something that we appreciate when a patient goes through the entire spectrum of treatment and becomes cancer free, as we say it at the end. Then those are the patients that we call survivors, because they are leaving legacy that breast cancer can be treated, and we appreciate the journey that they went through. Because it's not an easy journey for these patients. They go through a lot of pain. So yeah, those are the survivors. And if you look at the internet, there's a lot of good stuff that these patients go and then do to create awareness about cancer. Some do campaigns for charity, collection of funds to help treat other patients. So that is a positive impact that we are seeing that is coming out of the good treatment that we are giving to these patients. Yes, so I think that is all what survivorship is about.
Oh, nice. Another question, maybe, if you can help us understand, can breast cancer lead to any psychological illness?
Well, I mean, I wouldn't say psychological illness, like it can't cause schizophrenia and you know, mental illnesses, but as I say, it can cause severe depression even. It can cause a lot of anxiety, it can cause mood changes, you know, it can cause loss of confidence of these women, especially the ones who are not getting good support from their family. So yes, it can cause a lot of psychological stress. And just to add is that these ladies need a lot of support. They are fighting a very serious disease, and there's no battle that is won without support behind you. You have to have that support. And if the audience have such people in their family, then I would request them to give these people maximum support and motivation, because they can't fight this without their support.
True. Maybe as we wind up, I'm having a very hard question that is really making me feel like this is a killer disease indeed. But now, what should someone who realize that maybe he or she have been diagnosed with breast cancer, what should this person do first? Because now you realize that you have signs and symptoms of breast cancer. You realize that you have been diagnosed with breast cancer. You as a person, what should you do first?
Well, I think obviously if you feel that you do have cancer from the symptoms that we've talked about, then the first thing for you to do would be to go to a hospital or to approach a doctor who has good knowledge about what you're dealing with, because we have specialists. I mean, not in the medical field, they're specialists for everything. Only in cancer we have so many subspecialties. We have the surgeons, the surgical oncologist, we have the oncologist who give the chemotherapy. So I can't become an expert at giving chemo radiation because I'm not a medical oncologist. But a medical oncologist cannot come and say we can do surgeries, because they're not surgeons. So I think you need to make sure that you go to a proper hospital, approach the right doctor, because cancer treatment is only successful if it starts in the right direction. So you have to make sure, and it's your responsibility to do so, that you go to a center where there's proper treatment being given.
At your capacity, in your where you work maybe, how many people do you diagnose with breast cancer, and which stage mostly?
We diagnose many patients with breast cancer, unfortunately, because as you said yourself, according to the WHO criteria, worldwide, not only in Kenya, it is one of the commonest cancers, if not the commonest, especially in women. It's extremely common. So, I mean, if I was to run a clinic, I would see at least maybe, if I saw like 10 patients, out of those 10 patients, probably 6 or 7 of them would be breast cancer patients. So you can imagine that's a heavy load that we have in the country and also worldwide. And yeah, I mean, it's pretty common. That's all I can say. The burden is there. It's a heavy burden.
It's a heavy burden. How can someone find you? That is one. And two, your message to those people using this camera, your message to those people who are home. Either some of them are infected with breast cancer, and some of them are not aware of their status, and lastly, some have the signs and symptoms of breast cancer. Your message, and maybe if you have a physical location and your business number, maybe through this camera.
Okay, thank you. So, well, I can be reached out on 0711 444 234. That's my contact number. Or you can send me an email on Khan Iram, that is KHAN IRAM 781 at yahoo.com. I have an office at Dr. Spark Plaza in Parklands on 3rd floor. Now, my message to the ladies or anybody who is suffering from this tumor is that it is a hopeful tumor. It is not one of those tumors that we diagnose and we feel we can't treat. We have treated many and we will treat many. All we need to do is to make sure that these ladies come to us in good time and we can start their proper treatment. And I want to give hope to these ladies that breast cancer is a treatable disease, and so don't feel like you are alone in this fight, because we are all there with you, and we will make sure that we will get the best treatment as best as possible. And yeah, don't lose hope, because you're strong. Thank you so much.
Thank you so much, Daktari, for making time
Thank
to
you.
be here. Inshallah,
Thank you for having me.
We look forward to be having you. We do a lot of this. We have a lot of these impactful conversations. Indeed, I believe our viewers back at home have been impacted by whatever you said. To our viewers back at home, ladies and gentlemen, As you've been told, men can be infected with breast cancer, and also women can also be infected with breast cancer. The most people who are at risk are women. Make sure that you visit or you see the doctor anytime you feel like you are not well. You know yourself very well. Don't wait until it's late. Until next time, my name is Kasim Mustafa. I was standing in for Zamzam Ahmed. Ma salam.